Hi, thank you for joining us for our 2025-2026 Access California Annual Report for the Client and Consumer Population. In this section, we will share a little bit about the history of our Access California program, Cal Voices, and the Commission for Behavioral Health. We will introduce you to our Access California program team, highlight the goals and objectives of the 2026 program year. You will hear from two of our dedicated program partners, and we will end with key takeaways as we look ahead to our third year of Access California programming. Access California is a program of Cal Voices that is funded by the Behavioral Health Services Act through a contract administered by the Commission for Behavioral Health, now known as the Behavioral Health Services Oversight and Accountability Commission. Launched in 2017, Access California is Cal Voices' statewide client-run behavioral health advocacy program. Its mission is to strengthen and expand client participation in local and state-level advocacy and build knowledge and skills that expand individual and community empowerment. Through Access California's ongoing research, data collection and evaluation, policy analysis, advocacy, education, training, outreach, and engagement activities, it implements strategies to elevate the voices, identify the needs, and increase genuine public participation of client stakeholders to drive truly transformative change in California's public behavioral health system. Access California works with local advocates and organizations throughout the state to provide training, technical assistance, and support to county behavioral health agencies, clients, and other stakeholders to strengthen community collaboration and client involvement in local behavioral health planning and decision-making. Access California also works directly with state behavioral health agencies and the California legislature to represent the client voice in discussions regarding important issues and promote policies that meet the needs of clients receiving and/or eligible for public behavioral health services. Access stands for Advancing Client and Community Empowerment Through Sustainable Solutions. And through the transition of the BHSA, Access will continue to center and uphold the core values of the Mental Health Services Act, including cultural competence, client-driven adult systems of care, family-driven children's systems of care, wellness, recovery, and resilience-focused integrated services experiences for clients and their families. Access continues to apply client and behavioral health leadership strategies that it has honed over its years of advocacy, education, and coalition building experience. Client-focused strategies such as treating clients as valued participants in public behavioral health service planning and decision-making activities, educating clients about their rights, providing advocacy training, and connecting them with resources and strategies to empower them with knowledge and skills to become effective advocates, and modeling effective public advocacy techniques to help clients promote stigma reduction and foster greater appreciation for client involvement. And leadership-focused strategies include fostering deeper understanding of behavioral health funding sources, programming mandates, statutory and regulatory requirements, and other laws governing the public behavioral health system, services, and outcomes. Supporting state and local leaders' efforts to engage clients in the public behavioral health system planning and decision-making activities. Demonstrating effective public advocacy skills to reduce stigma and foster greater appreciation for client involvement. Providing leaders with practical guidance, recommendations, and best practices to expand client inclusion and participation, peer support, and recovery-oriented services, utilization of recovery outcomes, system transparency, and public accountability. Promoting adequate funding for peer support programs and consumer-operated services as cost-effective, evidence-based practices and a way to tackle the state's astronomical consumer unemployment rate. Access California is funded by California's Behavioral Health Services Act. In 2023, California's legislature sought to overhaul the 2001 Mental Health Services Act to use its revenues to address the state's growing unhoused crisis. To accomplish this, the legislature placed Proposition 1 on the March 2024 primary ballot, which voters approved by 50.18%. And Proposition 1 did all of the following: renamed the Mental Health Services Act to the Behavioral Health Services Act, and expanded its purpose to include substance use disorders, including for persons without a mental illness. Changed how revenue from the 1% tax on income above $1 million is spent under the law, including requiring 30% of the Behavioral Health Services Fund be allocated to housing intervention programs. Increased the size of the Oversight Commission from 16 to 27 voting members, and issued $6.38 billion in bond funds to fund housing for unhoused individuals and veterans, including up to $4.4 billion for mental health care and drug or alcohol treatment facilities, and $2 billion for housing for unhoused persons. Founded in 1946, Cal Voices is one of the oldest continuously operated, client-run advocacy organizations in California. Cal Voices is an affiliate of Mental Health America, the country's oldest and largest nonprofit organization addressing all aspects of mental health. In our 80 years as an organization, Cal Voices has provided behavioral health clients with culturally affirming peer support services, assistance in navigating various human service agencies, and advocacy for client-oriented public behavioral health policies. Currently, Cal Voices operates peer support programs in Amador, Placer, and Sacramento counties, and provides training, education, technical assistance, and advocacy for peers, clients, providers, counties, and other agencies across the state. Cal Voices' mission is to represent the self-identified needs and priorities of clients and consumers in the public behavioral health system through culturally relevant and recovery-focused advocacy, outreach, education, and peer support. For nearly 3 decades, Cal Voices has employed advocates embedded in county mental health systems to promote change from within, and has advanced individual empowerment and self-advocacy for mental health consumers through the direct provision of peer support services rooted in the recovery model of care. In 2004, Cal Voices strongly advocated on behalf of Prop 63, investing hundreds of staff and volunteer hours to promote the passage of the landmark Mental Health Services Act initiative. In all of our activities, we seek to elevate the voices of consumers receiving public behavioral health services. Of our dedicated staff of over 50 employees who thoroughly reflect the cultural communities and populations we serve, 99% of our staff identify as clients, family members, or both, including our executive leadership team and all of our program managers. More than 90% of our employees work in designated peer roles, which require personal lived experience of recovery from a behavioral health challenge and/or personal lived experience as a family member of a child, youth, or adult with serious behavioral health condition as a minimum qualification for employment. Cal Voices programs address the behavioral health needs of consumers and family members across the lifespan, from children and transition-age youth to adults, parents and caregivers, and older adults. And all of these age groups are well represented in our diverse network of employees. Cal Voices is well versed in the recovery model, community inclusiveness, and stakeholder engagement principles, and peer employment issues as they relate to services, processes, and practices within the public behavioral health system. In all of its 13 peer-run programs, Cal Voices wholeheartedly strives to continue to implement the MHSA's general standards, including community collaboration, cultural competence, client-driven services, wellness and recovery focus, and integrated service experience for clients and their families as we step into the BHSA transformation. As mentioned, Access California is funded by a contract administered by the Commission for Behavioral Health, also known as the Behavioral Health Services Oversight and Accountability Commission, or BHSOAC. Cal Voices' partnership with the BHSOAC began in 2017. The Behavioral Health Services Oversight and Accountability Commission oversees the implementation of the Prop 1 initiative, which imposed a 1% income tax on wealthy residents to pay for behavioral health services, and establish a framework for continuous improvement of behavioral health care in the state. The Commission partners with public and private behavioral health agencies at all levels and works to ensure that people get the care they need in a timely, comprehensive, effective, and culturally competent manner. In everything, it vigorously promotes community collaboration. The Commission's primary focus is to oversee the implementation of the Behavioral Health Services Act. The Commission advises the Governor and Legislature on behavioral health policy and distributes grants, collects and shares spending and efficacy data on local programs, spreads best practices, conducts research into critical subject matter areas like criminal justice involvement of people with behavioral health needs, and engages experts to develop policy proposals and other solutions. As we look ahead to navigate the changes of the behavioral health transformation, we are grateful for the Commission's ongoing support and encouragement and its dedication to improving the lives of behavioral health clients throughout California. In this section, we'll introduce you to our Access California program team. Danielle Zavala is Cal Voices Associate Director and General Counsel. She is a licensed attorney and has lived experience of recovery from several behavioral health conditions. Since joining Cal Voices in 2012, she co-founded the agency's Workforce Integration Support and Education Peer Training Program, also known as WISE-U, in 2015, and founded the Access California statewide advocacy program in 2017. For the past decade, Danielle has served as an educator and subject matter expert in peer employment and behavioral health advocacy. Danielle earned her Juris Doctorate degree from the UC Berkeley School of Law and was admitted to the State Bar of California in 2007. Nicole Chilton is Program Manager of Cal Voices Access California Program, Program Director of California Association of Peer Professionals, and has been working for Cal Voices for over a year and a half. She has a passion for advocacy, prevention, mentorship, and began her work rooted in the community in various roles within social service programs since 2013. Nicole believes in the power of hope in recovery and relies on her lived experience with depression and recovery to meet everyone where they are at. Maron Agnifer is Cal Voices Policy Director. Prior to joining Cal Voices, she served as a policy manager at the California Black Health Network and worked as a legislative aide for the California State Assembly under Assembly members Chris Holden and Shirley Weber. Additionally, she was a policy consultant in the Speaker's Office of Research and Floor Analysis, and has worked as a policy consultant for UC Health. With over 14 years of experience in health policy, Maron is committed to advancing equitable health initiatives. Maron holds a Master's of Arts in African Studies, focusing on conflict resolution from Howard University, and a Master's of Studies in Law, specializing in government from the UC Hastings College of Law. Grace Gallagher is the Education Coordinator for Cal Voices Access California program and Program Coordinator for California Association of Peer Professionals. With 6 years of working for Cal Voices in various roles, Grace draws on her lived experience as both a consumer and family member to foster meaningful connections within the behavioral health community. Her passion for advocacy drives her to empower peers and create a lasting impact in the field. Jocelyn Farrell is the program coordinator for Cal Voices Access California program. She is driven by her personal experiences with recovery and is passionate about dismantling the stigma around mental illness, promoting the worth and dignity of all individuals, and empowering others to pursue healing and wholeness. Now we'll share with you what we do within our Access California program activities. To address emerging issues affecting clients, consumers, rural communities, diverse populations, individuals with SMI, SUD, and/or co-occurring SMI and SUD conditions, with an emphasis on individuals chronically homeless or at risk of homelessness, involved in or at risk of entering the criminal justice system, re-entering the community from prison, jail, or a youth correctional facility, in the child welfare system, at risk of conservatorship, or at risk of institutionalization, Access California incorporates the following activities and events into its overall advocacy strategy. We convene a robust statewide coalition of local-level entities, allied CBOs, grassroots advocates, and peer professionals. We monitor pending legislation and statewide policy issues and analyze their impacts on public behavioral health services, clients, recovery-based programming, peer-run and consumer-operated agencies and programs, and peer support professionals throughout the state. We participate in legislative hearings and state agency meetings, work directly with lawmakers and their staff, and foster partnerships with leaders at state and local agencies to inform and influence policy decisions. In particular, Cal Voices continues to focus on the impacts of Prop 1 and other efforts to modernize the public behavioral health services to shape and inform the implementation of legislative changes representing client and peer interests and elevating stakeholder voices at all levels and stages in the process. We collect data and feedback to inform policy activities, trainings, and advocacy. We develop content, materials, and communications to educate and inform clients, consumers, and allies about pending policy changes, their potential impacts, and ways to make their voices heard. And we inform state and local decision makers about client needs and preferences, client inclusion, and policy development and decision-making at the state and local levels, and best practices in the design and delivery of behavioral health services. We cultivate an informed and engaged cohort of client subject matter experts to provide their voices and perspectives on state-level policy issues and connect them with opportunities to participate in state-level advocacy activities. We host an annual statewide advocacy event for peers, clients, consumers, and allies who are seeking to actively influence system change within their counties. And we publish this annual report to highlight the voices and experience of clients to inform state and decision makers on the critical behavioral health needs. Throughout this annual report, Access California team members will share major activities conducted throughout the 2025-2026 contract year, along with key outcomes, challenges and barriers, and lessons learned as we work closely with our statewide partners to meet the needs of the Behavioral Health Services Act priority populations, rural communities, and diverse populations through our state-level advocacy, local-level advocacy, training and education, and outreach and engagement activities throughout year 2 of our contract.
Cal Voices Access California program envisions a California public behavioral health system in which voluntary, high-quality behavioral health services are readily accessible to those in need and are designed and implemented to provide clients with the tools and resources they require to achieve lasting recovery. To accomplish this vision, this project incorporated a variety of local-level advocacy activities, which were shaped by and delivered in collaboration with our 12 regional local-level entities throughout the state. As outlined in our contract strategy, local level entities serve as critical partners in identifying community needs, engaging in local behavioral health planning processes, and ensuring that the voices of individuals with lived experience are meaningfully represented. With the transition from MHSA to BHSA, this work became even more essential. We intentionally positioned Access as a bridge, translating complex statewide policy changes into actionable community-level advocacy and ensuring that local perspectives were elevated back to state-level conversations. Our regional LLEs assisted us in completing 20 quarterly local-level advocacy activities, 4 in each of the 5 regions, that include the following tasks to accomplish our overall local-level advocacy objectives. Advocating to local behavioral health decision makers through public comment at meetings, written communications, participation in county-sponsored listening sessions and stakeholder feedback forums, hosting local policy discussions and trainings for decision makers, clients, providers, and community partners, participating in the BHSA community program planning process and local review processes, recruiting clients and peers to serve on local advisory and decision-making bodies, engaging, organizing, and activating local clients, peers, advocates, and allies, identifying local clients' and peers' unmet needs and potential policy solutions to address them, implementing annual surveys and other data collection efforts, sharing subject matter expertise, research, and evidence-based best practices related to rural communities, diverse populations, recovery-oriented models of care, recovery outcomes, harm reduction strategies, peer support services, and legal rights and responsibilities. Our primary audience was clients and consumers, communities and local advocates, peer-run agencies and programs, peer support workers, community members, so local advocates, stakeholders, family members, and supporters of clients and consumers, and consumer advocacy networks and organizations, so other statewide advocacy contractors, state and local behavioral health advocacy agencies, and state and local chapters of national advocacy organizations. Our secondary audience was also local level policymakers, providers, and the general public. The activities outlined in this section of the contract helped us to achieve the following objectives: promote engagement and participation of the client population, promote system transformation that is client and family driven, culturally competent, and collaborative in design, provide activities and events led by the client population that highlight local mental health services available, identify existing needs in local communities, reduce stigma, and inform local and statewide leadership on the specific needs of the client population, address the specific needs and concerns shared by participants from the Commission's listening session and community engagement with clients, represent clients' needs at the local level by conducting activities and utilizing strategies that target local decision-making entities, include meetings, activities, and events that encourage engagement and collaboration between local decision-making entities and community members and leaders, create opportunities for clients to influence local behavioral health policies and decisions, bring greater attention to the mental health needs and challenges of the rural communities in the region among local decision-making entities, and document the socioeconomic factors that contribute to the mental and behavioral health issues in the region to bring it to the state level. Now, we'd like to introduce our 12 local level entities. These are trusted, community-based partners across California who play a critical role in advancing behavioral health advocacy at the state and local level in partnership with us, the Cal Voices Access California program.
In the Bay Area region, we partnered with the Law Foundation of Silicon Valley and Black Men Speak in Alameda County. Established nearly 50 years ago, the Law Foundation of Silicon Valley uses innovative legal advocacy as a tool for social change. They work tirelessly to ensure that every person in their thriving region is granted the same rights and legal access. Every day, their attorneys, social workers, and advocates craft inventive solutions to the life-changing legal issues facing low-income people in Silicon Valley. Its mission is to advance the rights of underrepresented individuals and families in its diverse community through legal services, strategic advocacy, and educational outreach. Black Men Speak in Alameda County believes in the transformative power of storytelling and highlights individual experiences, challenges, and triumphs to inspire change and promote understanding.
Their mission is to inform and enlighten the mental health community and the general public about issues concerning men and women of color suffering from mental health and substance abuse challenges through storytelling, thereby promoting and increasing wellness, recovery, and freedom. In the Central Region, we partnered with Peer Recovery Services of San Joaquin County and Sustainable Wellness Solutions in Sacramento County. Peer Recovery Services of San Joaquin County proudly operates 3 wellness centers in Stockton, Lodi, and Manteca. Peer Recovery Services is a peer-run organization that offers free mental health and substance use support services, as well as mental health education for their community to promote wellness and recovery and reduce stigma surrounding mental health. Sustainable Wellness Solutions in Sacramento County was established in 1989 as Consumer Self-Help Center. Sustainable Wellness Solutions believes that healing occurs through relationships with other human beings. The organization recognizes that no one recovers alone, which is why peer support is central to their approach. Today, Sustainable Wellness Solutions operates several programs led by skilled and experienced staff who know how to effectively co-create these peer relationships. In the Los Angeles region, we partnered with Mental Health Advocacy Services and Painted Brain. Mental Health Advocacy Services was founded in 1977 to provide free legal services to people with mental health disabilities. For nearly 50 years, Mental Health Advocacy Services has helped low-income adults and children fight housing discrimination, obtain access to the rights and benefits to which they are legally entitled, and remove other legal barriers that impact their overall health and well-being. Its mission is to protect and advance the legal rights of low-income adults and children with mental health disabilities and empower them to assert those rights in order to maximize their autonomy, achieve equity, and secure the resources they need to thrive. Painted Brain began as a community-based arts group in 2006 and has evolved into a multifaceted behavioral health provider in Los Angeles County, California. They are a peer-run 501c3 and a majority BIPOC woman-led organization that creates lasting, community-based solutions to mental health challenges and the impact of social injustice through arts, advocacy, and enterprise. Since their inception, they have provided services to people impacted by behavioral health challenges, social injustice, poverty, and incarceration systems. In the Southern region, we partnered with Communities Voices in San Diego County, Peer Professionals of California in San Diego County, Peer Voices United in Orange County, and the Happier Life Project in Riverside County. Communities Voices is a nonprofit organization founded and run by female BIPOC peers. Founded in 2022 during the height of the COVID-19 pandemic, its mission is to provide emotional support, non-clinical counseling services, and community services navigation, as well as to build a network of community organizations throughout the state of California to facilitate connections with the public. It offers peer counseling, weekly support groups, and collaboration and navigation services. Peer Professionals of California is a 501c3 nonprofit community-based organization that provides services to communities in need. Its services address the justice involved, peer support, and community health needs throughout San Diego County. By advocating for the rights, well-being, and potential of aging and disabled inmates, as well as high-profile inmates, it strives to create a correctional environment that fosters growth, understanding, and second chances. Programs include justice-involved reentry services, peer support services, and community health worker services. Peer Voices United is a collaborative initiative powered by Peer Voices of Orange County and 10 behavioral health partner organizations. Together, they work to empower individuals navigating challenges such as homelessness, unemployment, trauma, mental health conditions, substance use disorders, incarceration, and community reentry. Its mission is to create a movement that unites diverse voices within the behavioral healthcare community, expanding the reach and enhancing the quality of services for those who need them most. The Happier Life Project is a recovery community organization that shifts perspective, reduces stigma, and provides hope around recovery. Their mission is to provide community support for people and families impacted by substance use disorders and mental health challenges through education, advocacy, and peer-based recovery support services with the intent to normalize recovery. Finally, in the Superior region, we partnered with Youth for Change in Butte County and Sunrays of Hope in Modoc County. Youth for Change is a diversified, private nonprofit dedicated to enhancing the lives of children, individuals, families, and communities. Primarily serving clients and families in Butte, Sutter Yuba, Glenn, and Shasta counties, Youth for Change is an inclusive, caring, and resilient agency that works from a set of core values, allowing them to deliver trauma-informed, culturally sensitive, and client-centered services. Sunrays of Hope is fully committed to empowering its peers and community through the education and support needed to gain overall wellness. Sunrays of Hope strives to provide the best accessible and acceptable county population services, using culturally and age-appropriate material to maximize wellness and recovery. In partnership with local community agencies through a contractual agreement with Modoc County Behavioral Health Services, Sunrays of Hope provides peer and community support, referrals, training, activities, and socialization.
During the Year 2 reporting period, Access completed a range of deliverables aligned with the goals, objectives, and scope of work outlined in the contract. In partnership with our LLEs, 5 local-level activities were completed each quarter, so a total of 20 local-level advocacy activities were required over the span of the Year 2 contract. Each quarter, LLEs were required to complete 1 Bay Area Region local-level advocacy activity, 1 Central Region local-level advocacy activity, 1 Los Angeles Region local-level advocacy activity, 1 Southern Region local-level advocacy activity, and finally, 1 Superior Region local-level advocacy activity. These local-level advocacy activities allowed us to grow Access's stakeholder network of clients, peers, leaders, advocates, and allies, engage, activate, and empower local clients and peers to participate in local-level decision-making, strengthen collaboration between clients, peers, LLEs, and local decision-makers, and expand opportunities for clients and peers to influence local policies and decisions, bring attention to the behavioral health needs and challenges of rural communities, identify socioeconomic factors that contribute to the behavioral health issues in the region, and shape and inform Access's other state and local activities, policy priorities, and strategies. Partnering with such a diverse group of agencies meant that each agency brought their own valuable areas of passion and expertise, whether that be legal services, services for youth, reentry and rehabilitation, SUD services, or peer support services. Our goal in partnering together was to empower them to be effective advocates within their unique spheres of influence, united by our common vision of a voluntary, recovery-oriented public behavioral health system, and influencing change in ways that are only possible through mutual collaboration. Our LLEs completed a total of 41 local-level advocacy activities throughout the year. LLEs spoke at county advisory board meetings, county behavioral health department meetings, and local coalitions, committees, and task forces, advocating for increased funding for peer support, the continuation and/or expansion of consumer-operated services, and for peers to be involved in local-level decision-making processes. Additionally, our LLEs provided education to clients and peers about how to actively participate in their county's local CPP process, engaged in participatory defense to advocate for the rights of individuals experiencing mental illness within the court system, provided voluntariness training to resident doctors to encourage the prioritization of voluntary mental health care, and educated county officials on housing-first models of care. Lastly, they provided training to law enforcement on how to respond to individuals with misunderstood disorders in nonviolent ways. We asked our local level entities to share a little bit about their experience working with our Access California program throughout year 2 of the contract, and here's what they had to say.
Hello everyone, I'm Thomas Bean, Lead Recovery Coach for Peer Recovery Services in San Joaquin County. Last year, Rosie and I shared how our partnership with Access California was just beginning to take root. This year, I'm proud to represent the collective energy of our entire PRS team. Following a monumental year of growth and advocacy, I'm excited to share how we've turned insightful content into real-world action that is transforming lives in our community. Our Power and Support team has been incredibly busy. You might remember us mentioning our very first Lunch and Learn last year. Well, I'm proud to say we successfully hosted 2 of them this year. These weren't just meetings, they were strategic hubs where we shared advocacy tools with community members and CBOs, proving that our collective knowledge is our greatest asset. We are currently in a pivotal season for behavioral health. Even though we are facing and preparing for the significant challenges caused by Proposition 1, we are pushing forward. We've been training our members on how to effectively give public comments, ensuring that as the system changes, the peer voice isn't just heard, but respected. We've taken that training straight to the Behavioral Health Advisory Board meetings, where Peer Recovery Services recently delivered a presentation highlighting the vital benefits of peer support within San Joaquin County. During this meeting, each of the Power and Support team members who attended provided public comments addressing how the wellness centers have personally affected their lives. By showcasing these successes, we are effectively addressing individual issues and advocating for the needs of our community, with a dedicated seat at the table. Moving forward, the members of our center plan on attending these monthly meetings as well as other public forums consistently to ensure our voices remain a part of the conversation. And if you've been to an outreach event in our county lately, you've likely noticed us. The whole PRS team has been manning tables throughout the region, promoting the vital importance of peer support and advocacy. We are out there every day, showing that our lived experience is the most powerful tool for change. Finally, I want to extend a deep thank you to the staff at Cal Voices in Access California for your unwavering support. We are looking forward to another year of working, networking, and learning alongside all of the LLEs who are part of this movement. We are stronger together, and the work continues. Thank you.
Hi, I'm Don Morrison, Peer Services Program Manager with Youth for Change, a community-based behavioral health agency in Chico, Butte County. I manage a peer support staff contracted to the neighboring Sutter-Yuba Combined Counties Behavioral Health System, where we have certified peers working in the Wellness and Recovery Center and 2 other programs. What was it like to work with the Access program? Well, it has been quite a pleasure and very informative. All the staff I've worked with in Access have been courteous, professional, knowledgeable, and very responsive to any communication and information requests from me. Regarding content, I've learned different methods of advocacy and the levels of decision making these methods are effective in. I've learned information about how the county's community planning process works, information about the structure and inner workings of county and state behavioral health systems, information on the structure and background workings of the state legislature, along with information and updates on current and upcoming legislation regarding peer support issues in the behavioral health system. How has our collaboration enhanced my local advocacy work? Well, it kickstarted me to a new level of advocacy action. I attended 4 different county community planning process events last fall, and at each one I spoke, advocating for either the continued funding of the county's wellness and recovery centers or for an increase in the number of peer support positions in the county's behavioral health system to better serve those community members in need. Before this collaboration with Access, I'd never spoken or written to a behavioral health advisory board. Any specific local accomplishments? Well, in regards to Butte County, we're still waiting to hear how the county will support its wellness centers and peer support services, and we are told this should be soon. Regarding our own staff of certified peer support specialists working in Sutter-Yuba Behavioral Health System, we fully embraced billing Medi-Cal for our peer services last year, both for group and one-to-one services. And due to our contacts and exposure with Access and the partner agencies, we're starting to be able to share our process in standing up and maintaining this effective newer funding source with other peer support programs in the state. This is in hopes of helping these agencies preserve and ideally grow the level of peer support services being offered in their areas. We are looking forward to another productive year of working with Access California and their partner agencies. Thank you.
Good morning, everyone. My name is Mirona Gonifer. I'm a policy director with CalVoices. Today, I will go over some of the CalVoices priority bills, budget ask, and initiatives. So before we go into the budgets, bills and initiative proposals that we are working on, let's go over CalVoices guiding principles and values. So they are to protect behavioral health funding by ensuring public funds are dedicated to community-based behavioral health services. Voluntary participation focused on voluntary engagement, opposing involuntary holds and government coercion, empower clients with decision-making authority and informed consent in their care, maximize local government flexibility to tailor behavioral health services to community needs, include clients in all aspects of behavioral health policy making to ensure their voices are heard, focus services on promoting long-term recovery and quality of life through a holistic care approach, integrate peer supports across the care continuum, ensuring fair compensation and adherence to professional standards, address health disparities in underserved populations and through cultural, responsive, and trauma-informed services. So we at CalVoices works in collaboration with partners. We have local, regional partners throughout the regions, national and statewide behavioral health organizations, coalitions based on policy areas, local and statewide agencies, individual experts in relevant areas. Based on the guiding principles and values outlined earlier, CalVoices supports several bills and budget requests in any given legislative sessions. We will highlight 2 bills, 2 budget requests, an update on the gubernatorial candidate debate forum. Here to save time, we provide quarterly updates and encourage you to register for them, please. So let's start with AB 96 Jackson. It's sponsored by CalVoices and CBHDA. It would remove the high school requirement for certified medical peer support specialists. So the purpose is requiring a high school diploma or equivalent may create artificial barriers to entry and limit access for individuals with the potential to excel in peer support roles. AB 96 would eliminate that barrier and open the opportunity for thousands of Californians to become CMPSS. The bill passed the House with the full support of the legislature and enjoys support from about 30 organizations and growing, as well as from counties of Sacramento and Alameda. To see the recorded support in the assembly held, we have provided you with the link. Currently, the bill is in the Senate rules awaiting referral. In the next slide, we have the support of the coalition support letter, which was signed by over 20 organizations. The second bill that we're going to look at is AB 2138 CREL. It's Medical Enhanced Care Management, Peer Support Specialists. That's the title of the bill. So it integrates peer support specialists as standard members of enhanced care management interdisciplinary care teams to enhance support for medical members. The bill allows ECM providers to employ various staffing models, ensuring that peer support specialists are effectively integrated and accessible to members. The purpose of this bill is by encouraging ECM providers to include CMPSS in various staffing models. The bill ensures that ECM target populations enrolled in medical managed care can access improved evidence-based peer support services. The bill is referred to the Assembly Health Committee. CalVoices submitted a coalition letter, including Painted Brain, Sunrays of Hope, Interim, and Compro. So this is the support letter the CalVoices submitted to Assembly Health along with our partners. Now we cover two priority bills. Let's go over two key CalVoices budget asks. So the first one is funding for the peer personnel training and placement program. What we had done, we requested to establish a dedicated fund of $14 million annually for the peer personnel training and placement program. It's administered by HCI, so the funding was supposed to for the fiscal year of 2025 and 2026. This funding is essential to address the severe shortage of qualified individuals capable of delivering critical and culturally relevant services to individuals facing behavioral health challenges. The purpose is to ensure that peer personnel receive the necessary training and support, enhancing their ability to provide culturally competent care and effectively address our community's complex needs in behavioral health. So our partners for this budget ask is Painted Brain, Disability Rights California, Mental Health Association of San Francisco, NAIMI San Diego, Imperial Counties, and Mental Health of America of California. Outcome? Fortunately, HCI maintained funding for the peer personnel training and placement program. The legislature did not approve the budget request due to California's difficult fiscal position. However, the coalition has every intent to advocate for dedicated funding for this critical program once the California fiscal climate improves. The other budget request that we are initiating or undertaking involves HR 1, the role of certified medical peer support specialist. The law imposes new work requirement for Medicaid enrollees aged 19 to 64, covered through the Affordable Care Act Medicaid expansion, mandating that they work, volunteer, or participate in educational programs for at least 80 hours per month. The implementation of this work requirement raises serious concern for California. About 3.4 million medical members could lose coverage, potentially increasing the uninsured rate and adding extra financial pressures on healthcare providers. The 6-month eligibility redetermination requirement might cause an additional 400,000 adults to lose coverage, along with an expected annual loss of $30 billion in federal Medicaid funding. In conjunction with the County Behavioral Health Director Association, CalVoices is asking in the 2026-27 budget cycle. Here is the proposal. The proposal is to include certified peers alongside navigators to assist with medical eligibility, enrollment, and retention, and leverage their efforts to outreach and engagement with clients affected by H.R. 1. So our activities involved so far: engagement with the state legislatures, DHCS, and college HR. We are elevating this critical issue to help millions of Californians retain their medical benefit. CalVoices this year sponsored gubernatorial candidate debates. So the overview and objective of the debate. CalVoices co-sponsored the California gubernatorial candidate debate on February 3rd, 2026 at the Ruth Williams Memorial Bayview Opera House in San Francisco, California. The gubernatorial candidate's response to our questionnaire addressed peer support services. We have the link here for you to watch the entire debate. The forum required candidates to respond directly to policy questions, including behavioral health related issues developed in partnership with community-based organizations. The debate covered topics such as access to behavioral health care, with an emphasis on expanding the workforce of peer support specialists. Please visit this link to read candidates' response. So what is our overall objective? Our strategic goals in this gubernatorial candidate forum is to establish thought leadership, position the California gubernatorial debate and its questionnaire-driven accountability model as a replicable framework for community-led political engagement, educate voters, provide comprehensive data-driven analysis of candidates' commitment to enable informed voting decisions across the June 3rd primary and November general elections, build accountability infrastructure, create tracking mechanism to hold elected officials to their promised beyond election day. Finally, strengthen coalition capacity, deepen partnership across aligned civic engagement and community empowerment organization through collaborative research and shared advocacy. So, regarding the pre-debate, CalVoices engaged communities to identify and prioritize policy issues related to behavioral health, including the peer workforce. Post-debate, CalVoices strongly encouraged community members to complete the post-debate survey to include their input in the final policy white paper. So the link for that is available here. So we are working on a policy paper assessing gubernatorial candidates' positions and conducting a California behavioral health workforce assessment for public dissemination. The debate was the first of its kind and was extremely successful. We were able to achieve this critical public services in collaboration with our partners, including, of course, CalVoices, the Black Freedom Fund, Monkey Brain, the California African American Chamber of Commerce, National Education of 100 Black Women, Bay Area, the Abundance Network, the Bay Area Sigma, and the Black Leadership Council. To conclude, this presentation simply highlights the state policy advocacy efforts undertaken by CalVoices. We work on several bills and budget advocacy in any given legislative session. CalVoices engage communities to identify and prioritize behavioral health policy issues, including the peer workforce. We have newsletters, webinars, podcasts, social media, and conferences to involve the communities. We offer detailed policy updates quarterly, and we invite you to join those webinars. In addition, we hold ongoing meetings with our LLEs to incorporate their input and participation. We work closely with our partners, key to what we do. Please contact us with comments and questions at access@calvoices.org. Thank you for your time.
In year 2, CalVoices implemented the Training and Education Strategy Plan with an intentional focus on addressing the needs of the Behavioral Health Services Act priority populations. The target audiences for this project's training and education activities fall into 5 broad categories with some overlap between them. Training and education activities focused on different aspects and factors for different audiences. For our LLEs, training and education activities focused on preparing and supporting LLEs in their roles. For clients, advocates, allies, and community members, training and education activities focused on providing foundational information to facilitate participation in policy planning and decision-making. For peers and peer-run agencies, training and education focused on technical skills, practice guidelines, and program sustainability. For professionals and providers, training and education focused on raising awareness of clients' needs, effective client engagement, and recovery-oriented practices and outcomes with an emphasis on reducing disparities and increasing services in rural communities and BHSA priority populations. These priority populations include individuals living with serious mental illness, substance use disorders, or co-occurring disorders, with a particular emphasis on individuals who are chronically homeless or at risk of homelessness, involved in or at risk of entering the criminal justice system, re-entering their communities, involved in the child welfare system, or at risk of conservatorship or institutionalization. In addition, our training efforts prioritized engagement with rural communities and diverse populations, recognizing the disparities in access to services, information, and advocacy opportunities. For behavioral health leaders, training and education focused on improving systems, services, and outcomes, and reducing disparities for diverse and rural populations. All of the training and education activities were designed to include mental health providers, clinicians, therapists, peer workers, and other professionals, as well as recipients of mental health services, increase awareness of the mental health needs of diverse and rural communities, focus on the skills and knowledge necessary to meet the unique needs of clients and the consumer population, emphasize shared decision-making and equity in the facilitation of public discussion, include clients in training and education planning, design, and implementation to maximize effectiveness in increasing awareness and meeting clients' needs, include interpretation and translation training to meet clients' language needs, and lastly, include basic and/or beginner-level education courses to increase accessibility into serving clients for other service providers such as law enforcement, first responders, and emergency room clinical staff. This year, Access held a 2-day training event to welcome and orient both returning and new LLEs to develop annual priorities and strategies and provide education and training around their roles and responsibilities. This included train the trainer components. The first day of the training retreat included a policy update about the emerging changes from the MHSA to the BHSA. Following the policy update was the Advocacy Coalition meeting, where each LLE had an opportunity to discuss their work and local level impacts. Together, we looked at the first BHSA community planning process in each county, and each LLE had the opportunity to strategize, ask questions, and seek technical assistance for the initiatives they were most interested in. We also used this time as a listening session for access to understand how to best support the local level advocacy efforts of our LLEs. The second day of the retreat, the Access team provided an in-depth walkthrough of the LLE's Year 2 subcontracts, identifying significant changes and updates from Year 1. Each quarter of Year 2, the Access program delivered a live webinar, each covering a different training topic, which were recorded and made publicly available on CalVoice's social media. Target audiences for these trainings included LLEs, clients, advocates, allies, and community members, peers and peer-run agencies, professionals and providers, and lastly, behavioral health leaders, both state and local decision makers. The first training webinar in March 2025 provided an overview of mental health disability within the social safety net and equipped participants with an understanding of behavioral health transformation, including system gaps, policy changes, and their impact on individuals with serious mental illness and substance use disorder. The second training webinar in June 2025 provided an in-depth overview of how the community planning process under the Mental Health Services Act has been fundamentally altered by Proposition 1 and the Behavioral Health Services Act, equipping participants with an understanding of funding, spending rules, and stakeholder engagement requirements. The third training in September 2025 provided an overview of Medi-Cal mental health services and the state fair hearing process, equipping advocates with the knowledge to understand available services, navigate the two-system structure, manage care plans and county mental health plans, and challenge denials or delays in care. It also highlighted common barriers to accessing services, such as long wait times, lack of assessments, and service limitations, and offered practical guidance on using grievances, appeals, and state hearings to ensure individuals receive medically necessary mental health supports. The fourth and last training in December 2025 focused on advancing a peer workforce for people who use substances by highlighting gaps in California's current peer certification system and proposing a specialized training pathway to better support individuals with substance use and co-occurring conditions. It provided an in-depth overview of policy shifts, including SB 803, BHSA, BH Connect, and opioid settlement funding, while outlining how people who use substances specialization could expand peer roles in harm reduction, overdose response, and system navigation to improve outcomes and reduce preventable deaths. In Year 2, the Access team conducted 5 behavioral health transformation workshops across regions in California. We held these workshops in the Central, Superior, Southern, Los Angeles, and Bay Area regions. The 2025 Behavioral Health Transformation Workshops provided an in-depth education on California's behavioral health transformation and the community planning process, including new BHSA programs, expanded Medi-Cal services, and the evolving of certified Medi-Cal peer support specialists. Through interactive training grounded in law, ethics, advocacy, and education, participants gained practical strategies to engage in local planning processes, serve on behavioral health boards, and advocate for peers as both providers and clients in the public behavioral health system. Our target audiences for these events included clients, advocates, allies, and community members, peers, peer support specialists, community health workers, decision makers, and peer-run agencies. Some of the goals for these events were to promote engagement and participation of the client population, promote system transformation that is client and family-driven, culturally competent and collaborative in design, provide activities and events led by the client population that highlight local mental health services, identify existing needs in local communities, reduce stigma, and inform local and statewide leadership on the specific needs of the client population, address the specific needs and concerns shared by participants from the Commission's listening session and community engagement with clients. Through our behavioral health transformation workshops, participants consistently expressed a number of key barriers and concerns related to BHSA implementation. A primary theme was confusion and lack of clarity. Many attendees reported difficulty understanding how the transition from MHSA to BHSA would impact funding, services, and local planning processes. This was especially true given the complexity of the policy changes and the pace at which they were being implemented. Participants also highlighted a lack of accessible plain language information, which created additional barriers to meaningful engagement, particularly for individuals with lived experience who are not working directly within policy spaces. Another significant concern was the perceived reduction in community voice within the community planning process. Attendees expressed concern that changes under BHSA would limit opportunities for stakeholder input and reduce the influence of local communities in decision-making. There were also strong concerns about funding shifts, particularly the reallocation of resources toward housing interventions and how that may impact funding for peer services and community-based programs. In addition, participants identified practical barriers to participation, including time constraints, technology access, and transportation, especially for individuals in rural and underserved communities. Overall, these workshops highlighted the need for continued education, technical assistance, and advocacy to ensure that the voices of priority populations remain central in behavioral health system transformation. As a result of the behavioral health transformation workshops, several key outcomes and accomplishments were observed. Participants demonstrated an increased understanding of BHSA and broader system changes, including funding structures, service priorities, and planning processes. We also saw an improved ability to engage in community planning processes and local decision-making spaces, as participants were better equipped to participate meaningfully. There was a clear increase in advocacy confidence, particularly among individuals with lived experience, who reported feeling more prepared to engage with stakeholders and share their perspectives. Importantly, these workshops created a structured opportunity to elevate community concerns, lived experience insights, and identified system gaps. One of the key takeaways from our behavioral health transformation workshops was the ongoing need for accessible, plain language policy education. Participants consistently emphasized that without clear and understandable information, meaningful engagement and advocacy in planning processes becomes very limited. There was also a strong demand for guidance on BHSA implementation, particularly around how funding changes and new program requirements would impact services at the local level. Another major takeaway was the continued concern around the peer workforce, including questions about sustainability, funding, and the evolving role of certified Medi-Cal peer support specialists within the system. Participants also expressed a desire for more meaningful opportunities to engage in community planning processes, highlighting concerns about reduced input and influence under BHSA. Additionally, the workshops reinforced that rural and underserved communities require more intentional and targeted engagement strategies, as barriers to access remain very significant. Cal Voices synthesized this feedback and shared it directly with the Commission for Behavioral Health, where then it was used to help inform the development of the Community Partner Toolkit, ensuring that the voices of priority populations were reflected in tools intended to guide local implementation of BHSA. This demonstrates the program's role not only in building capacity, but in influencing statewide resources and implementation efforts. Finally, it became clear that training cannot be a one-time event. It must be ongoing, responsive, and directly connected to real opportunities for advocacy and participation. These insights will continue to inform how we design and deliver training and support engagement moving forward. While being able to assist the Commission for Behavioral Health in informing their new Community Partner Toolkit was a major accomplishment for Access this year, we also saw expanded engagement from rural and underserved communities, helping to address disparities in access to information and advocacy opportunities within their local communities. Overall, these outcomes reflect meaningful progress in increasing knowledge, strengthening advocacy, and ensuring that community voice is integrated into system transformation. This year's Access annual conference was called Peering Forward, the Future of Peer Services in California. We had approximately 180 people attend this event. Our target audiences included LLEs, clients, advocates, allies and community members, peers and peer-run agencies, professionals and providers, and lastly, behavioral health leaders. The 2026 Access California Annual Conference served as a comprehensive statewide training and engagement event designed to strengthen the knowledge, skills, and advocacy capacity of behavioral health clients, certified Medi-Cal peer support specialists, and community stakeholders within California's public behavioral health system. The conference provided an in-depth education on key policy developments, including Proposition 1, the Behavioral Health Services Act, AB 96, and federal Medicaid changes, while also examining their impacts on service delivery, funding structures, and the sustainability of the peer workforce. Through a structured agenda that included policy presentations, workforce data analysis, peer-led panels, and a behavioral health transformation stakeholder workshop, participants engaged in critical discussions around meaningful peer integration, consumer-operated services, and strategies to address system gaps and disparities. The event also created opportunities for participants to contribute feedback, collaborate across regions, and engage in advocacy efforts, including informing future policy priorities and participation in statewide initiatives such as the Gubernatorial Candidate Forum. Overall, the conference advanced the goals of Access California by promoting community collaboration, supporting informed stakeholder participation, and ensuring that the voices of individuals with lived experience are integrated into behavioral health policy development and system transformation efforts. We conducted 2 different panels at the 2026 annual conference this year. The first panel was our Peer Certification and Meaningful Integration panel. This first panel highlighted lived experience perspectives, where peer workers and advocates shared personal insights on navigating the behavioral health system, emphasizing the importance of recovery-oriented, culturally responsive, and community-based services, and panelists discussed barriers such as access to care, the destabilization of the peer profession, and system complexity, while also underscoring the critical role of peer support in fostering trust, engagement, and improved outcomes in our communities. The second panel was our peer-run services in the BHSA panel. This second panel focused on the peer workforce and system-level change, exploring the evolving role of certified Medi-Cal peer support specialists within the California's behavioral health system. Panelists addressed topics such as workforce sustainability, funding shifts under BHSA, integration of peers into clinical settings, and the need to protect and expand peer-led and consumer-operated services. Together, the panels reinforced the importance of centering lived experience, strengthening the peer workforce, and ensuring that system transformation efforts remain grounded in the needs of the communities most impacted. Overall, feedback from attendees was overwhelmingly positive, with the majority of participants rating key components, including policy updates, panels, presenters, and overall content as excellent or good. Participants consistently noted that the conference was highly relevant and appropriate to their work and experience levels, with most indicating it was very relevant or very appropriate. Attendees especially valued high-quality presenters and panelists, particularly those with lived experience, clear and timely policy information, especially related to BHSA and Proposition 1, opportunities for connection, community building, and shared lived experience, and lastly, a well-organized event, including smooth registration, check-in, and logistics. Key themes from our qualitative feedback included participants highlighting that the conference was informative, empowering, and helping them better understand how to navigate system changes, It helped them create a strong sense of community and belonging, particularly among peers and advocates. And it provided meaningful opportunities to learn, reflect, and engage in advocacy. While feedback was largely positive, attendees identified a few areas for growth. They desired more inclusive representation, so veteran communities or diverse lived experience. They requested additional breaks or shorter sessions or earlier end times. And they suggested to improve breakout session logistics, audio, pacing, captions, etc. And lastly, they emphasized a continued need for accessible plain language information and deeper dives into policy topics.
Our Year 2 outreach and engagement included our annual peer workforce survey, our monthly podcast episodes, and our quarterly newsletters. The goals of our outreach and engagement efforts during Year 2 were to 1. Include the coordination and facilitation of strategically designed activities, events, and published materials to connect and inform community members, peers, community partners, and entities serving the population, including the BHSA priority populations. 2. Create opportunities for clients and community members to connect and engage with each other, increase awareness of available services, and develop the capacity of community members to self-advocate. 3. Provide opportunities for the population to become involved in advocacy and gain the skills and experience for advocating for their mental health needs at local and state levels. 4. Address misinformation, lack of information, and lack of education in relation to mental health needs and challenges. 5. Leverage mediums that are relevant and accessible to the population. And 6. Incorporate an easily accessible library of materials to access, learn from, and share with others. This year, as part of our outreach and engagement strategies, the Access California team conducted our second of 3 annual peer workforce surveys. Survey data and feedback helps us determine what is and is not working within the public behavioral health system by identifying unmet needs, emerging issues and trends, and best practices across the state. Cal Voices uses this survey information to design and refine our program activities to meet the needs of the client population, identify and elevate the mental and behavioral health needs of clients to state-level decision makers, uplift community voices and local stories to the state legislature, inform state-level decision makers and decision-making bodies on the socioeconomic risk factors, barriers, and challenges that negatively affect the abilities of clients to receive culturally appropriate and effective mental health services. And finally, advocate for state-level policy solutions that are recovery-oriented, client and family-driven, culturally competent, and collaborative in design. Specifically, our Year 2 peer workforce survey measured the following conditions which impact California's peer workforce: number of peer positions throughout California, systems and settings, funding sources, employment qualifications, wage and pay scales, employment benefits, working conditions, professional development, and career advancement, and the impacts of the Behavioral Health Services Act. This survey was completed by 248 peers, both certified and non-certified, and 38 peer employers, representing rural communities, diverse populations, and BHSA priority populations. Comparing the results of the Year 1 2024 Peer Workforce Survey with the results of the Year 2 2025 Peer Workforce Survey highlighted several important trends. One trend relates to the impact of SB 803. In 2024, 47% of peer respondents indicated that Medi-Cal Peer Support Specialist certification was required for their position. In 2025, that number increased to 61%, representing a significant barrier to the expansion of the peer workforce. Also of note, in 2024, 57% of peers and 50% of peer employers indicated that they are concerned about how the Behavioral Health Services Act will impact the sustainability of positions within their organization. In 2025, that number jumped to 62% of peers and 73% of peer employers expressing this concern. The results of this survey and these concerns shared by peers and peer employers about the future and sustainability of the peer workforce play a vital role in informing Cal Voice's legislative and policy priorities, including but not limited to AB 96. To support our outreach and engagement goals and objectives, the Access California team produced 12 monthly podcasts, which included guest speakers and subject matter experts who shared their unique knowledge, perspectives, and experience on relevant subjects. Target audiences of these podcasts included clients, advocates, allies and community members, peers and peer-run agencies, professionals and providers, and state and local behavioral health leaders. This year, the Access team reached 373 listeners through our podcast, many of whom represent the BHSA priority populations. One key lesson learned from our behavioral health transformation workshops and other events and activities is that members of our target audience come to us with a very wide range of background knowledge and experience relating to advocacy, the peer workforce, and the public behavioral health system. Many individuals were eager to get involved and learn more, but were understandably overwhelmed by the complexity of the issues at hand. This led us to take a new approach for Season 2 of our podcast. While our quarterly policy update webinars explored current policies and legislation in a more in-depth manner, and our quarterly training webinars provided deeper education on very specific issues impacting the public behavioral health system and the peer workforce, our monthly podcast episodes served as an entry point for new advocates. We used our podcast episodes as an easier, more accessible way for individuals new to behavioral health advocacy to begin exploring relevant issues, as well as to provide more seasoned advocates with helpful resources to share with their community members who may want to learn more. This year, we explored the basics of advocacy and current issues facing the peer workforce, the importance of language access in the behavioral health system, the challenges and successes of reaching rural regions, and more. We also published an episode promoting the Community Partner Toolkit, published by the Commission for Behavioral Health in February 2026, to introduce more community members to this resource, help them understand where, when, why, and how to become involved in their county's community planning process, and empower them to be more effective advocates in their communities. Since we wanted to ensure our podcasts were accessible to all audiences, regardless of background knowledge, we aim to keep most of our episodes between 15 and 25 minutes, while also including information for our audience on how to be further involved with Cal Voice's advocacy work. Something new we included this year was soliciting feedback from our audience members via social media, allowing them to provide input and ask questions related to the upcoming podcast episode topics, which is an engagement strategy we hope to continue and grow in year 3. We also learned this year that including guest speakers garnered greater engagement and allowed us to reach larger audiences. The images on this slide show 2 of our LLE podcast guests from the Superior region who shared their expertise and passion for reaching rural communities. These guests also paved the way for an exciting new development for year 3. As a result of this increased engagement we saw when incorporating LLEs and other special guests, we have committed to involving each of our LLEs in our podcasts in more meaningful ways in year 3 of this program, and we look forward to using our podcast as a platform to elevate their voices and share their expertise with a wider audience. Another way we supported our outreach and engagement goals was through our quarterly newsletter. Each quarter, the Access California team sent a comprehensive newsletter to over 10,000 individuals within our network, including clients and consumers, peers, behavioral health advocates and allies, and local and state level decision makers. We also supplemented our newsletters with shorter email blasts each quarter, highlighting and reminding individuals of important upcoming events and opportunities. These newsletters included links to previous training webinars, policy update webinars, and podcast episodes, as well as registration information for upcoming training webinars and policy update webinars. We also used these newsletters to promote our registration for our annual statewide conference, which was held in January 2026, as well as our regional behavioral health transformation workshops, which were held between August and October 2025. Finally, these newsletters served as a tool to cross-promote information about LLEs, other statewide advocacy contractors, program partners, and other important community resources like the Community Partner Toolkit published by CBH. One barrier we faced with disseminating information via our quarterly newsletters was reaching community members in rural regions where technological access is more limited. Because of this barrier, our partnerships in the Superior region became even more vital, and we're grateful for their support in helping us reach more members of the rural communities. One example of this challenge and resulting success came through the program liaison of one of our LLEs, Youth for Change, who personally shared our newsletters and event information with his contacts in Lake County and invited them to our events. We then formed strong connections with the leaders and peers within the Lake County Health Department, and these individuals now serve as conduits to ensure that the information and opportunities we send them through our newsletters is disseminated among their community, even to those we may not have been able to directly reach ourselves due to technological barriers. Another key lesson learned was the importance of sharing information about our events and activities across multiple platforms. While we were able to reach the largest audience by sending our newsletters to our network of over 10,000 individuals, we were able to reach our target audience most effectively by also including key information from our newsletters, such as flyers and registration links, in our podcast episodes and webinars. By ensuring the members of our community had access to important information multiple times and through multiple platforms, we were able to increase engagement and participation across all activities.
Thank you so much for listening to our Year 2 annual report. We will finish up by reviewing general takeaways, recommendations, and themes as we look ahead to Year 3 of programming. General takeaways from Year 2 include: clients are unsure how to navigate the changing public behavioral health system and are looking to Access California to provide leadership in this area. They want to be involved. Although the integrated plan calls for meaningful engagement, community input is limited to a 30-day period. If individuals don't have access to online resources, know what materials to seek out, or face barriers to participating due to complexities of understanding the BHSA, how can they provide meaningful input? They want workforce sustainability and funding for peer services, including a clear pathway for growth and pay equity that reflects their lived expertise that is fundamental to the peer workforce and its evidence-based practices. They want to break down silos, stigma, as well as discrimination that clients, consumer, peers, and individuals face when accessing behavioral health services. They are worried about clients and consumers falling through the cracks as priorities and funding shifts away from the emphasis of the bedrock of voluntary and evidence-based prevention services peers provide. They want federal and state policy that will strengthen client and family shared decision-making for clients and consumers, rural and diverse communities, and BHSA priority populations. As shared during the LLE section of this report, our local level entities are situated within rural and diverse communities. Furthermore, their local community leadership is critical to engaging priority populations as they are already working with these communities and have established trusting relationships. This community partnership approach operationalizes the MHSA's core value of cultural competence, which we continue to uphold in programming as individuals and agencies representing diverse communities and perspectives help us identify disparities and provide vital input on policy solutions. Last year, we shared that lack of resources, lack of services in a variety of languages, immigration status and childcare, insurance and other costs associated related to recovery services were identified as barriers. During this year's regional event conversations, advocacy coalition meetings, and conference discussions, these concerns continue to prove to be ongoing and growing barriers for individuals within rural, diverse, and BHSA priority populations. As funding for prevention services are being cut from county-level budgets, clients and consumers, peers, advocates, and consumer-operated organizations are feeling the immediate impact of the loss of prevention-based funding and closure of community-based programs available to address these concerns. As shared in the state-level advocacy section of this report, to address many of these concerns shared by LLEs, clients and consumers, consumer-operated service providers, and allies and advocates, our recommendations include: first, removing the high school requirement to eliminate the barrier and open the opportunity for thousands of Californians to become certified Medi-Cal peer support specialists through AB 96. Second, with AB 2138, encourage ECM providers to include certified Medi-Cal peer support specialists in various staffing models. The bill ensures that ECM target populations enrolled in Medi-Cal managed care can access improved evidence-based peer support services. Third, request to establish a dedicated fund of $14 million annually for the Peer Personnel Training and Placement Program. Fourth, include certified peers alongside navigators to assist with Medi-Cal eligibility, enrollment, and retention, and leverage their efforts for outreach and engagement with clients affected by H.R. 1. Furthermore, we would like to also highlight recommendations we included in our final quarterly report of this program year. First, prioritize accessible policy communication and support efforts that translate behavioral health policy developments into plain language for community stakeholders. Second, promote clearer definitions and practical guidance for counties regarding meaningful stakeholder engagement in behavioral health planning processes. Third, promote clearer guidance and support for counties regarding the use and implementation of community-defined evidence-based practices. And fourth, promote strategies that support the continued development and stability of the peer support workforce. As we reflect on Year 2 programming, we are grateful for the shared learning among hundreds of peers, clients and consumers, and allies we had the opportunity to connect with, and their commitment to nothing about us without us. Year 3 themes and objectives include BHSA CPP implementation. We will continue to work closely with our LLEs, clients and consumers, peers, allies, and CBOs throughout the year to invite feedback regarding their experiences at the local level to inform our local and state level advocacy. Second, Conduct training and education that is client and family driven, culturally competent, and elevate the behavioral health needs to reduce stigma within client, consumer, and BHSA priority populations. Third, preservation and sustainability of the peer workforce. We will continue to focus on eliminating the high school requirement for certified Medi-Cal peer support specialists through AB 96. Fourth, we will continue to advocate for statewide policy initiatives and legislation that will have the largest impact related to HR 1 and bring positive outcomes for behavioral health needs of clients. And finally, an ongoing objective from year 2 to year 3 is ongoing support of shifting availability and accessibility of voluntary public behavioral health services, assisting clients and communities in navigating behavioral health services provided through Medi-Cal managed care plans rather than county-based systems. Throughout each contract year, Access California conducts the following activities: 4 quarterly newsletters, 4 quarterly training webinars. So be on the lookout for more information coming soon as we're kicking off our first quarterly training webinar in May. Also scheduled to take place in May is the first of our 4 quarterly policy webinars. We also host 12 monthly podcasts, which will highlight our LLEs and their areas of expertise in year 3, available on YouTube soon. We host 5 regional events, which are coming up in early August. And finally, please mark your calendars for our annual statewide conference coming up in January 2027. All of our webinars and podcast episodes are recorded and available on Cal Voice's YouTube page. If you aren't able to join us in person, we hope that you'll join us virtually. We hope you've enjoyed this summary of our program activities and accomplishments during the 2025-2026 contract year. Stay in touch with Access California online at www.calvoices.org/access, by email at access@calvoices.org, by phone at 916-573-0522, and watch the recordings of past webinars and podcast episodes on Cal Voice's YouTube channel at www.youtube.com/@calvoices.